So endometriosis can present throughout a woman's reproductive years. We see young girls, teenagers, just starting their periods, complaining of pain and having endometriosis. We see women in their reproductive years when they're having their babies, and we see women who've completed their families. And the thing about endometriosis is it is a progressive condition. So it starts off as a mild condition and it gets worse with time. So just because you've got no endometriosis or no signs of endometriosis in your teens or your 20s doesn't mean it can't become a problem later in your 20s, 30s or 40s. The treatment of endometriosis is very different depending on when the woman will present. We don't treat a teenager the same way that we treat a woman who's trying to have babies or a woman who's completed her family. It's very important that we don't treat all the patients with the same approach, and it's very important that the first line of treatment for endometriosis is not surgery, specifically in your young patients. Every time a woman has surgery for endometriosis, the surgery can worsen her fertility. Surgery around the ovaries, surgery around the uterus and around the fallopian tubes causes scar tissue, causes an interference between the relationship between the fallopian tube and the ovaries, and worst is it causes a reduction in the eggs, the number of eggs in the ovaries, and these things will have significant impact on a woman's fertility. So interestingly, the women that we see with infertility related to endometriosis primarily have infertility related to the surgery that they had for their endometriosis. If endometriosis is treated medically, we see less complications and less fertility problems.